Ladies and gentlemen, very good morning. First of all, I'm very happy and delighted to be here in my second home country, because Pakistan is our brother country. We have a very long history with Pakistan since 100 years. We collaborate together, we help each other. We are a friend of bad days, not a good days. You can find friends in good days, but you don't find in bad days good friends, which support you, which stand with you. That's how we collaborate with Pakistan. That's why I'm very happy, and that's the reason I accept the invitation of my good brother, Dr. Zakir when he invited me to come and to deliver a speech and share my experience. I honored and I happily accepted with pleasure, and I'm here between you. Actually, I started my medical tourism journey 40 years ago. When I was in the university, a student, I was a tour guide, which I was guiding GCC people coming from Saudi and Kuwait and also from Sweden and different Norwegian citizens coming to a medical spa for thermal treatment. So I was a tour guide for those people who come for anti-aging and rehabilitation, physiotherapies, and etc. 40 years ago. Then my graduation ended, and I started my journey in tourism. I started with medical spa and thermal tourism incoming, doing the incoming to my country as a tourism and travel agencies. Then at the end, in 2005, I decided to convert this experience to an NGO, and I decided to establish and found a Turkish Healthcare Travel Council, which I invite all the stakeholders in 2005, like travel agencies, hotelier, thermal hotels and spa centers, and medical institutions like hospitals and clinics. With 32 members, we created our council. And we start our journey in 2005. So we start promoting officially under the NGO, under the Turkish Healthcare Travel Council. We start promoting our destination in 2005. Then I said that I need to see the examples who has started before us, like Thailand, India, United States, Germany. So I made a long trip, 55 days trips, without coming back to Turkey. I started with India, Thailand, Singapore, Malaysia, all these countries. Then I jumped to Europe and I visited Germany, England, France, the Vichy, and so many thermal resorts and medical spa centers. And I try to understand how they serve and how they show the hospitality to the international patient in order to transfer the different culture and different understanding to our stakeholders. So one of my visit was Bangkok Hospital when I visited, and I really amazed with their hospitality, with their different section for Japanese, a different section for GCC countries, with their culture. And when I visited the Bangkok hospital, I visited the Japanese special center, where special lounge for Japanese people. So you can watch Japanese TVs there when you are waiting, and you can read the Japanese newspaper when you are sitting, and I really amazed. And then I visited India, and I visited a hospital, Medanta. And I meet the founder of the Medanta Hospital. He's a very famous surgeon, cardiologist surgeon, doctor. And he was talking to me, and sometimes he was jumping behind of the door and coming back again. And I asked him, I said, why you do this? You jump, and he said, this is my operating room, just next to it, next to his office. He's talking to me when they need him. So he jumped to the operating room, and he just, advise them, and he's coming back to me. So Dr. Trihan, maybe you heard about him. So he's very famous surgeon. So I see in this hospital one full floor being dedicated for a companion, patient companion, where small rooms, small cabins, where the patient companions can come and lay and have some, rest. And I see that there is a cinema section where the companion can come and watch in the cinema rooms, some films and etc. from Bollywood. So I see a lot of different ideas and cultures, and I try to implement these ideas and mix and match and implement it in Turkey. So it was, for me, a long journey. Today we are 20th year anniversary for our establishment of our Turkish Healthcare Travel Council. But nevertheless, when I arrived to 2013, I see that there is no leading institution or NGO globally where can put together all this destination in order to govern us, or in order to bring some international patient rules and regulations, patient rights, ethical rules, and etc. So I started also going to America and joining the Medical Tourism Association events in 2007, the first event in San Francisco, second event in Los Angeles, then Chicago, then Miami. So I joined like 5 years row the events of Medical Tourism Association in United States. So I see that really also Medical Tourism Association, not a global body where can put together under one umbrella all the destination countries to talking together, to collaborate together, to share the experience in order to improve the quality of services for the world citizens. So we decided to invite 38 destination countries to Monaco, Monte Carlo in 2013. We as Turkish Healthcare Travel Council bear all the expenses of this travel and hosting for all this destination, and we invite them to Monaco. And we decided to establish Global Healthcare Travel Council in 2013 as a globally. So we started our journey in global arena as well, putting the rules and regulation and creating the international patient rights and ethical rules, ethical codes, and etc. So we start our journey with 14 founding countries, and then today we arrived to 56 country members for this association. And 3 years ago we decided to move the headquarters from Monaco to Brussels, and we register in Belgium under the Kingdom of Belgium. We have the accreditation and confirmation by the Kingdom, and we are accredited organization for the European Union. So today, Global Healthcare Travel Council, a leading body in the world, globally, from east to west, from Asia to America. We have members from United States, we have members from Asian countries as well, from India, China, all over these countries. So, of course, the global healthcare travel industry is moving rapidly and very fast. When I started, the figures was, when I was going to United States, the speakers, valuable speakers, which I was listening to them, they were talking about $100 billion of turnover for healthcare travel industry. Not only medical tourism, but medical spa, anti-aging, and so many other, sectors under the healthcare travel industry. So like senior travel for retirement travel, which European people, after they retired, they go to Philippines, Thailand, to Malaysia, Indonesia, and they retired there. They start living there. So the senior travel also under the healthcare travel industry, which we have a Jordan Declaration that healthcare industry and healthcare travel industry consists of 8 segments. One of them is medical travel, but the other segments are senior travel, dental tourism, sport tourism, culinary tourism, and etc. So industry was 100 billion on those years in 2008, 2009. When we arrived today, till the COVID, the industry was growing up to 800 billion, and today we are 2025, the new estimated figures going to $1 trillion, the medical travels. And there is no border for medical travelers or healthcare travelers. Today, we have a chart which is made by McKinsey, very interesting chart, showing that there is movement of international patient today, or international traveler for healthcare, seeking for healthcare services from east to west, from America to Asia, from Asia to America, and from Europe to Asia, Middle East to Europe to America. So there is amazing flow between the countries. So today we arrive in a point that the human organs start being replaced by the human-made organs. So the technology is moving, and now new era started with AI integrated to medicine and digitalization. Of course, AI are always going and picking up the research and the articles and the information which is being created by the human. So the human resource and human work need to be always in advance, that artificial intelligence can go and pick up from there. So today, the artificial intelligence and technology becoming in front of experience, front of so many, expertise and etc. But when we do some kind of research today, and when we ask to AI about a kind of treatment, not always we get the right answer, because they are picking up from different sources and different information, and sometimes you end up with mess. I mean, directing the patient or the human to the different wrong direction. So still the human experience and human work need to be there, and going to be there always in order to correct the mistakes of AIs. AIs doesn't mean that giving you always the right way. But of course, AI today for our next generation is a kind of warning, a dangerous, quite dangerous for our next generation. In order to develop themselves, today so many students using internet and doing their research and doing their homework or preparation for their studies or for their articles or something, going to very easy way. Before, in my age, when I was in the university, I was going to the library and searching the books, specific books about this specific things, and I was sitting and reading it and spending time and trying to analyze it and etc. But today is not the same way. The new generation are getting the easy way, easy path, AI and searching, putting and preparing, and this is kind of for our future generation, kind of not very good, but hope that we will still keep the human touch there, and human control is there, and that's what I believe. Without human control and human brain, the AI will not gonna find good source to direct you. So global healthcare travel industry has a good future, and I recommend to my friend from Pakistan to union together and put an NGO like Pakistan Healthcare Travel Council, from hospitals, travel agencies, facilitators, as we have done 20 years ago. And I recommend that first things that you have to be together in order to act together, to put an NGO that you can start to promote yourself in your niche areas where you can receive an international patient from your surrounding countries. That's what we have done before we started with our neighbor countries. First with our neighbors, then the second stage and phase, we start going to the 4 or 5 hour flight distance, then 8 hour distance, then 10 hour distance. So you need to start from your neighbor countries, non-developed neighbor countries, and you need to pick up. You cannot promote all your areas. My recommendation, don't promote medical tourism in all picture, all direction. Try to pick up specific areas. Today I was talking one of your professor, doctors, he is specialist in orthopedic. For example, orthopedic surgeries. It can be a niche surgery, knee and hip replacement. From UK, you have millions of people are waiting list for knee and hip replacement. And UK and Pakistan has historically related each other, and so many ambassadors you have in UK. Who is the ambassador? Not the political ambassador or diplomatic ambassador. Each and every single doctors, Pakistani doctors, is your brand ambassador in UK. So if you use your brand ambassadors in UK, you have over maybe 10,000 doctors working in UK. So if you use them, those people and those ambassadors branding you, branding your destination, would be a great success for you in niche areas where you need to start. So this is my recommendation I would like to share from my end, and I will gonna share in my panel the Turkey journey for 20 years, what we have done by government side, by politicians, by private sectors, by stakeholders. I will give you all examples with my presentation, and I will share our experience for 20 years. Maybe you may benefit from this experience and get some examples. And we are always here to talk and to share our experience with our brother country, Pakistan. Thank you very much for listening to me and having me here as a speaker. Thank you.